Hello, good afternoon. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. I hope you had a wonderful weekend, and I hope you're currently having a wonderful weekend. Remember that every weekend about this time, we will normally bring out a topic of importance, and we talk about the topic and we learn about the topic. Today, we're talking about recurrent miscarriages, or recurrent, or what we call habitual abortion. So that's what we're going to talk about. It's a problem that so many people are currently going through. It's a problem that can actually affect you in so many negative ways. Dr. Diche, thank you so much. So when you join, if you've been through this problem before, if you've been through this challenge before, there is hope. There are certain things you can do. So what I'm intending to do this afternoon is to share the stepwise approach of how you can overcome miscarriages and still end up becoming pregnant and having your babies. When you have miscarriage, there are so many things that change. There are so many factors we look at. There are so many parameters we have to assess. It's not something you just have to believe that it's just going to happen. You have to follow due process. So that's what I'm going to do this evening. So when you join, I need to know your name and I need to know where you're located. Feel free to send this video to anybody out there that might need help, especially if they've been through miscarriages. It's going to help them a lot. I'm planning to spend a few minutes to explain. Then once I'm done with explanations, you can have an opportunity to ask your questions. So today we're going to look at how to overcome recurrent miscarriages and succeed in becoming pregnant and actually have a baby. You see, in our group, we are not just interested in helping you to become pregnant. When we are done helping you to become pregnant, we also want to help you to have your baby in your hands. It will not make sense to become pregnant and you don't have a baby. So that's our aim. So my belief is that if you've been through miscarriages, it's the moment you've been waiting for. You can imbibe the knowledge I'm going to impact on you this evening, that you can overcome miscarriages and you can start your family. So let's start with the common definition of miscarriage. When a woman is pregnant, it's expected that a couple of things will change in her body to make sure that that pregnancy is carried up to term. When you carry your pregnancy up to 37 weeks, that pregnancy is classified as term. Term pretty much means the baby is good to go. So if anything happens and a baby is born from 37 weeks, 38, 39, 40, up to 42 weeks, we don't expect any pregnancy to exceed 42 weeks. Once a pregnancy goes beyond 42 weeks, it's classified as post-term. Now we expect that baby to go through first trimester, the first 3 months, second trimester, the second 3 months, and the third trimester, the third 3 months. During the third trimester, there will be changes in the body of a woman, especially the cervix, to make provisions for the baby to be given birth to. You go through labor. There are a couple of places in the body of a woman we want to be secure in pregnancy. One of those areas is the cervix. Once you are confirmed pregnant, we don't want the cervix to change. We don't want the cervix to be weak. We don't want the cervix to be loose. We want the cervix to be completely tight, because once you have cervical incompetency, once there is instability in the cervix is going to weaken and the baby obviously is going to be born before the time. And sometimes when this happens, the outcome might not be user-friendly. So miscarriage is the unintended end of your pregnancy before 20 weeks. Unintended end of your pregnancy before 20 weeks. There's another terminology for another pregnancy loss beyond 20 weeks. That's called stillbirth. So pregnancy loss can be categorized into miscarriage or abortion. So remember, in medical field, abortion and miscarriage are used interchangeably. They are the same thing. But when the when the pregnancy loss happens beyond 20 weeks, it's called stillbirth. The commonest cause of miscarriage out there is actually chromosomal problems or developmental problems. When a baby has chromosomal problems, unfortunately, there is no quick fix. So chromosomal problems means when the parents were exchanging their chromosomes, they had an error and the baby was not fully formed the way the baby should be. Now, some other babies might have developmental problems. So any organ in the baby that goes into error mode in course of development can actually lead to miscarriage. Now, for stillbirth, majority of the stillbirth problems are due to placenta problems, infections, or growth restrictions. These are the commoner things that can lead to either miscarriage or stillbirth. So it is important to take into cognizance 20 weeks. 20 weeks is the tiebreaker. When you lose your pregnancy before 20 weeks, miscarriage. After 20 weeks, stillbirth. Now, it's a very emotionally damaging development. No woman wants to hear that her baby is no longer viable. No intending father wants to hear that. So it's something that will definitely change you emotionally, spiritually, physically. You will feel like the world is coming to an end. Now, both of them can be emotionally challenging. You need a lot of support to make sure you overcome and eventually have your baby in your hands. Now, majority of women might actually have miscarriages without even knowing they had miscarriage. Most miscarriages are not reported because by the time a woman will think she's not pregnant, she's actually miscarried. And that baby will pass in as big clothes. So there are so many women that will become pregnant because they might not actively be looking forward to becoming pregnant. They can miscarry. There are some miscarriages that can be silent miscarriages. We call it missed abortion. The baby is no longer viable, but you didn't bleed, you didn't have pain. So the baby inside actually dies silently and nobody knew. So, but we are talking about solutions. How can we mitigate? How can we assuage? How can we end up still becoming pregnant and still making sure that women actually have their babies? Number one step you have to embark on if you've had more than 2 miscarriages. So what we are discussing today is recurrent miscarriages or habitual abortion. So recurrent miscarriages means having more than 2 consecutive miscarriages. So if your 3 previous pregnancies ended before 20 weeks, you have recurrent miscarriages. Please don't embark on the 4th pregnancy. You need to follow the steps I'm going to share with you. Number one step, you have to seek medical help immediately. So there are some doctors that are actually trained in helping women that have recurrent miscarriages to manage them, to follow them up, to know what's going on. So you need to consult with a high risk. So the fact you've had more than 2 pregnancy losses places you in the category of high risk. There are a couple of other things that can also place your pregnancy as high risk. So once you are in this category, you must consult a high risk pregnancy specialist. Very important. We call them reproductive endocrinologists or fetal-maternal specialists. You have to see a specialist, a specific doctor who is actually designed and designated to be the only person that will help you professionally. So you're not supposed to see a baseline ordinary gynecologist. No, you're not supposed to see a baseline ordinary obstetrician. You need to be referred to a reproductive endocrinologist or fetal maternal specialist. They will take time to figure out what's going on. So all the women in this clinic right now, if you have had more than 2 miscarriages, number one management protocol is to get referral to this specialist. They are very few in number. You must go for them. Now, when you get to them, we are going to run a lot of diagnostic testing. So diagnosis means trying to find out what could actually be the problem. So when you go to this reproductive endocrinologist or fetal maternal specialist, we're going to run a lot of diagnostic testing. So you're going to undergo a lot of chromosomal abnormality check, hormonal imbalance check, uterine issues. So we're going to draw your blood. We're going to run ultrasound. We're going to run some panel. We're going to check a lot of things. We're going to check your blood group. We're going to check your genotype. We're going to run a lot of things to see if we can actually discover what could be leading to this. It's called diagnostic testing. We'll go through all processes, check your urine, check your blood, check your womb, check everything about you, which might be playing a role in contributing to this. So it's important you follow the steps. Remember, number one, you must be referred immediately to reproductive endocrinologist, who is considered a high-risk pregnancy specialist. Now, once you've gone through the diagnostic testing, then we're going to discover what the problem is. So we're going to address the underlying issues. So the test we're going to run is going to tell us if the woman has some underlying problems. Is it chromosomal problems? Does the woman have polycystic ovarian syndrome? What about the thyroid? Polycystic ovarian syndrome can cause this. Thyroid problem can cause this. Structural problems can cause this. Undiagnosed or poorly managed diabetes mellitus can cause this. Poorly managed hypertension can cause this. Your body weight can cause this. Metabolic syndrome can cause. So there are so many things that can cause this. So once we discover what the problem is, we begin to address them. So addressing the underlying problem will help us. For example, there are some infections that can also predispose you to having miscarriages. If we discover that infections, we have to treat it appropriately, especially if they are bacterial infections. So the next thing to do is medications. So whatever medications we are going to give any woman that had previous history of miscarriages will be based on the diagnostic testing, will be based on the underlying problem. So assuming your progesterone level is low and it's not supporting pregnancy as adequately as it should, we're going to give you hormone replacement. Assuming you have some discovered infection, we're going to give you antibiotics. Assuming in course of checking, we discover you have cervical incompetence, we're going to give you cervical sacklage. We're going to place you on monitoring. We're going to tell you to avoid lovemaking to make sure that you have a good chance in your pregnancy. So the management with medications is based on the outcome of your hormonal panel. So if we run your progesterone level and it's low, we're going to give you progesterone drugs depending on the route so that you can have adequate progesterone, because progesterone is the pregnancy maintaining hormone. For your pregnancy to be carried to term, you have to have adequate level of progesterone, because it's progesterone that maintains the pregnancy, make sure the baby goes through first trimester, second trimester, third trimester until you have your baby. Now, number 5, there are a couple of lifestyle modifications you have to maintain immediately. You have to watch your body weight immediately. You have to watch what you eat immediately. You have to exercise regularly. You have to manage stress. Of course, you don't have any business smoking. You don't have any business drinking alcohol. I'm talking about stopping all this immediately. Watch your body weight. If your body mass index is not within normal range, work on your body mass index. Make sure you avoid stress. Make sure you get enough sleep. Make sure you drink a lot of water. Don't smoke. Don't take alcohol. Possibly refuse and avoid any caffeine-related products. When you do this, together with the medications we're going to give you, together with the cervical sacklage we're going to give you, together with monitoring, together with being careful by not making love within the time you become pregnant, we will gradually manage your pregnancy until you get to 37 weeks. Now, you also need support groups. There are some women that might be going through what you're currently going through. If you find a support group of such women, they can help you a lot. Support group will help you to cope with emotional challenges, psychological challenges. Now, when you're doing this, you also have to think outside the box. There are alternative routes of still having a baby. So if for some reasons, the reason why you're having miscarriages recurrently is because your womb is practically, functionally, and anatomically flawed. That means for some reasons, your womb is not able to carry your baby, then we need to think outside the box. We need to think about alternatives. Thinking about alternative means we have to think about egg donation, sperm donation, and surrogacy. Unfortunately, there are some women that their womb is badly damaged. The womb cannot carry a baby. No matter what you do, no matter where you go, once pregnancy enters the womb is not going to carry that baby. So if you happen to be in this category, you have to go for surrogacy. So in going for surrogacy, we're going to recruit another lady that will carry your baby. So that baby is going to grow in that woman's womb. Once the baby is born, the baby will be yours 100%. That's an option. You have to think about this. So we have to think about egg, embryo donation, sperm donation, surrogacy, and of course, adoption. They are all options that will help you. Then eventually, you have to go for emotional healing. You see, your emotions are very important in having a baby. So you have to prioritize your emotional healing. You have to seek counseling for grief, for anxiety, for depression. You have to remember that becoming a mother will require patience, resilience, exploring different pathways. There is no one pathway that will lead to motherhood. There are at least 6 different ways you can be a mother. Any woman can be a mother, but there are some women that might not necessarily go through pregnancy to become a mother. But at any age, any woman that chooses to be a mother can be a mother. So eventually, when you go through these 8 steps, you're going to become pregnant. You're going to stay hopeful. You're going to keep trusting the team of people that are managing you. And you're going to keep looking for solutions that will help you to overcome. There are some couples that had 3 miscarriages, 5 miscarriages, until they found solutions. I have a classmate in my first degree. One person was asking about miscarriages in our group, and he opened up to me. He told me that the first 3 pregnancies they had problems, but they were referred to St. Nicholas Hospital in Lagos, and they had a specialist that involves in this type of issues, and they went there and they found solutions. Subsequently, they had 3 kids. So the fact you've had miscarriage in the past doesn't mean that subsequently you're going to have miscarriages. Matter of fact, majority of women that had the first miscarriage, most of them will be due to chromosomal problems. You will eventually overcome that and have your baby. So if you have had miscarriage in the past and it's chromosomally related, subsequent pregnancies, the chances of you carrying your baby to term is very high. But if you keep having miscarriages more than twice, 3, 4, 5, stop right there. It's painful to become pregnant and you don't have your baby. That's the point you need to seek help. That's the point you have to apply the 8 concepts. Remember, emotional healing, alternative options, support groups, lifestyle changes, medications, addressing the underlying issues, diagnostic testing, and of course, seeking professional help. If you can apply all this, then by the end of 2024, you will be called a mother, you'll be called a father. So that's my presentation, and I'm going to allow you to start asking your questions. I can see one of my students in the mentor group, Abraham. Abraham, it's good to have you in the clinic. So please, you can start asking your questions. Okay, so moderator Chinyere is asking, can a woman who is undergoing fertility treatment still exercise? Of course, 100%. Matter of fact, exercising when you're believing to have a baby will help to stabilize and balance your hormones. You see, a woman that exercises regularly, not going overboard, possibility that her estrogen is going to be normal is high, possibility that the progesterone is going to be normal is high, possibility follicular stimulating hormone, luteinizing hormone, thyroid hormones, your prolactin levels will be high. Why? Because when your body weight is outside the normal range, when we plot your BMI, which we can plot with your body weight and your height, and is above 25, you are in the overweight range, or above 30, you are in the obesity range. What is it going to do? It's going to alter your hormones. So there are some women that will start converting their estrogen to androgens. Androgens ordinarily are supposed to be higher in men. Now, there are some men that will start converting their androgens to estrogen, distorting their normal hormonal function. And the problem in women is, once any of your reproductive hormones go out of sync, so either they are higher or lower, it will affect their function. So for example, if your estrogen goes up or goes down, it's going to affect the whole totality of ovulation and all that. The same thing is applicable to progesterone. The same thing is applicable to FSH. The same thing is applicable to LH. There are some hormones that will fluctuate by default, by nature, as you're getting older. For example, as you're getting older from age 35, the level of your estrogen will start reducing. When your estrogen level reduces, you will start experiencing hot flushes, dry vagina, low libido. You will actually notice it, because once your estrogen drops, estrogen is what makes a woman to feel wet and to feel like a woman and to feel like making love. As you're aging, it will drop. Now, when estrogen is dropping, your follicular stimulating hormone, which is a very important hormone that plays role in ovulation, will start going up together with LH. So once you have FSH going up, LH going up, estrogen coming down, is a function of your aging. And it's an entailment that, look, your fertility is reducing. So virtually all women that get to age 35 will notice this. When you cross age 35 and you eventually become pregnant, you'll be classified as advanced in maternal age mother. We keep a golden eye on you, because your chances of having good outcome in pregnancy is reduced because of a couple of complications that can happen from that age. So yes, whether you're going for IVF, IUI, natural pregnancy, make sure you indulge in regular exercise. Regular, moderate exercise. It's going to help your body weight. It's going to stabilize your hormone. It's going to improve your stress. It's going to remove all the stress and anxiety you might be having. It's going to improve your endorphins. Endorphins are feel-good hormones. Hormones that will make you to actually want your partner to make love to you, and you actually enjoy your lovemaking. So it's very important. Okay? If a woman undergoes sacklage, will she need sacklage for subsequent pregnancies? 100%. So by default, if you have cervical incompetence, and thankfully we discovered you had cervical incompetence, and we gave you cervical sacklage. So cervical incompetence means the cervix, which is the junction between the vagina and the womb, it's not healthy. It's unstable. It's insufficient. So we'll carefully go in and tie the cervix. Surgical process of doing that. We can do it through the vagina or we can do it abdominally. So when we do this, either it's towards the time you're getting to 10, we're going to remove those sutures, you're going to have your baby. Subsequent pregnancies, in order to take precautionary measures, you will continue to have cervical sacklard. So a woman that had one cervical sacklard, when she becomes pregnant in the future, prophylactically, based on preventive measures, based on thinking about what could happen, we're going to give her prophylactic cervical sacklard. So the answer is yes. Once you've had cervical sacklard, subsequent pregnancies, we're going to give you prophylactic cervical sacklard. I love that question. It looks like it's only the moderator that is asking questions. What about this maker, Redus, and Abraham? You're a medical student. You should have some questions. So please feel free and ask all your questions, okay? How can a woman who has had infertility for a while manage anxiety and when she eventually conceives? You see, there are certain things we can do about our mood. There are certain things we can do about our mental health, right? There are certain things we can control. Then there are certain things we can't control. Now, by yourself, if you understand your why, if you change a couple of your lifestyle, for example, you exercise, you drink a lot of water, you avoid alcohol, you don't smoke, you sleep properly up to 7 to 8 hours. By default, you are helping to mitigate unnecessary stress. So there are some stressors you can manage by yourself. There are things we think so much about, things we can't change. They cause us a lot of anxiety. Anxiety is by default what keeps everybody healthy. But when you exceed the expected level of managing your anxiety, then you can have anxiety disorder or you can develop depression and all that. So if you modify your lifestyle, if you look out on the positive side of life, if you look out on the sunny side of life, then you can mitigate the problem. For example, if you sleep properly, if you drink your water, if you make love, if you avoid alcohol, if you have good company, if you have a doctor that will attend to you, then you're gonna remove all the stressors you can't control. Now, a point will come when you will definitely consult with a mental health provider, and possibly if we need to place you on medications, we place you on some medications. So the answer is modification of your lifestyle. That's what you need, okay? All right. Do we have any other question? We have about 8 minutes to wrap up. So if you have questions, still feel free and ask your questions. Dr. Diche, do you have any question? Abraham, do you have any question? Mako, Ray, Redus, do you have any questions? If you have any questions, feel free, ask. I'll provide the feedbacks. Surprisingly, only 4 people attend the clinic. It's funny, things that will help us, we rarely show up. We look for quick fixes. I was thinking that a lot of people will attend this particular clinic because it's very important. So Chinyere, if you have other questions, feel free and ask. If not, we should start rounding up to get some break. Tomorrow I will be back, but it's going to be in Facebook for our Sunday fertility webinar. So don't miss tomorrow. We'll get a good topic. We talk about it. So my clinics in YouTube is every Saturdays by 3 p.m. Tomorrow is also going to be 3 p.m. Now, a big thing is actually happening this month. You see, there are some families that want to have a specific gender. So there are some families that have 4 boys and they want to add a tinge of girls, because let me tell you, having 1 boy can change the whole trajectory of your family. So imagine, like Chinyere is a mother of 3 boys. I can just imagine the war that goes on in her family. So there are some families that might have boys, and they want to add girls to the equation, and they can take care of the boys and girls, right? So a family of 4 might want to add 2 more girls. It's possible to have girls in 2024. It's possible to have boys in 2024. That's what we're going to talk about on the 24th. So if your family peace is threatened because you really want to have a particular gender, you're not having it. Like for people that are from the eastern part of Nigeria, they attach so much importance to male child, which is nonsense, because male and female child are the same thing. I'm gender blind. But the reason why we chose this topic is to help our members that genuinely want to intend to have a particular gender. And there is nothing wrong in wanting to have a particular gender. Absolutely nothing wrong. There is the reasoning behind it, and it's how you go about it. So anybody telling you, oh, hang your leg or wait for ovulation to do this, to do that, the possibility is going to fail is almost 99.9%. But there are reliable ways of having a baby girl, of having a baby boy, which you can hold your hands, teach you appropriately, and refer you to a doctor that will help you to achieve this. So that's what we're going to talk about on the 24th. So if you haven't registered, make sure you register appropriately, okay? All right. Abraham, I'm expecting you to ask your question. Is it possible for a woman to choose a particular, okay, Chinyere was actually mirroring the questioner. Yes, it's possible to have, to choose the gender of your baby. Yes, it is. Okay, we have the technologies to do that. Okay, all right. You do have questions. Does management of infertility in female involve evaluation of a male partner? Of course, 100%. Very important question from Abraham. But here's the deal. Whenever we have delays in conception, most people from developing countries will blame the woman. So there are families in Nigeria now, they believe that the reason why they don't have babies today is for the woman. But it's completely not true. Like, it's the opposite. Problems in delay in having a baby can come from the man, it can come from the woman. So infertility management is not only for the woman. It's actually a 50-50 thing. So while we are checking the woman, from the vagina up to the tubes, up to the ovaries, we have to check the man. The important area of the man we have to check is the semen. The semen is the vehicle that contains the sperm. So we have to ask the man to come, we collect the blood, we collect the sperm sample to check the quality of the sperm. So whenever we talk about infertility management, it's not just the woman. For the woman, we're going to do the hormonal profile, we're going to do the HSG, we're going to check the ovarian reserve, which is the most important test for any woman having delays in having a baby is ovarian reserve test. So we're going to collect your blood sample, then we run some check on your anti-Mullerian hormone. The level is going to tell us if you have good quantity of remaining eggs that you will eventually use to have your babies. Very important. So assessment of infertility is for the female and the male. Both of you must come back on the same table and we check both of you to see where you stand. Very, very important. Okay? All right. I love that question. Do we have any other question? We have about 4 more minutes to go. So if you have questions, feel free and ask. Make sure you copy this video and share with all your communities. So if you have a friend that has been complaining, oh, I can't have a baby, I need help, invite them to our group. There are different packages you can actually leverage on. So you can get your 1-week package, you can get your 1-month package, you can get your 3 months package, you can get your 6 months package. And of course, if you're pregnant, you can get your ASC package and we can meet you halfway and we can help you. So share this video liberally, make sure it goes viral. You know, we should form the habit of making important videos go viral, not videos that won't add value to you. If you go around in social media now, so many people are making contents just to make money. But these are important videos that can change your life, give you the knowledge you need, help you to start your family, help you to defeat infertility, and at the end of the day, help you to be happy. That's why we started all this. And there are thousands of videos which you've made since 2015 that all you need to do is to watch them. Now, if you're not in Nigeria to consult with me one-on-one through consultation, you can actually leverage on the optimization program. So our optimization program is a fertility design course. You can buy that program, you can go through the program, and you can improve your knowledge. Or you can plan to attend our masterclass. Our masterclass is normally the last Sunday of the month, but for the month of March, because the last Sunday of the month is going to be Easter, we're going to host our event on the 24th. You don't want to miss any of these events. So everybody is equally represented in our group. Okay? All right. Thank you for coming. I think I've come to the end. I don't have any other question. So I want to thank Chinyere, my amazing coordinator, the moderator, amazing. She's doing an amazing job. Thank you for all those wonderful questions. I want to thank Abraham, the medical student who I mentor. Thank you for coming around. It looks like you're the only person that attended. And Maycall Reduce, you didn't say much, but I hope you've been able to learn one or few things. So my next clinic on YouTube will be next Saturday, 3 p.m. We're going to find another topic. Before you leave today, make sure you subscribe to this channel, completely free. So click on that subscription button. Make sure you set your notifications to tell you when I come live. Then copy the link of this group and share it with anyone out there in all your social media handles. You never know who you might be helping by doing this. So thank you guys for coming. Victoria Ajibayi is also another medical student I mentor, if I remember correctly. So it's only Abraham and Victoria that attended the my presentation. So what I want both of you to do, please piggyback to our group. And once I'm done with this, just say, hey, Doc, I attended. I want to acknowledge you guys when we go back to our group, okay? But thank you so much. And thank you, Dr. Ndiche. I know you're behind the scenes, and you also always hang around to provide feedbacks. So until I see you guys, enjoy your weekend. And remember, if everything else fails, God will never fail you. So always pray to God. Continue to play. Play means regular lovemaking with your partner. Regular lovemaking in our group is defined as every other day. So every other day means if you made love today, you can have a break tomorrow. You can continue the following day. So have a break, continue, have a break, continue. That's what we're going to do to overcome infertility in our group. Until I see you guys, God bless you and bye-bye for now.